Africa CDC has an enormous role in the development of event-based surveillance in Zambia.
We, as Uganda Ministry of Health, the Emergency Operations Center particularly, we have really benefited from Africa CDC's efforts in event-based surveillance, giving us the framework and training us. Before 2022, Uganda was conducting event-based surveillance activities very well, but with the little knowledge that we had, we did not have any training, no framework, so we just hit and run. You say, okay, event-based surveillance, and then we start. Then came 2022 when we had formal engagement with the African Union, particularly Africa CDC. This is when we reached out to the head of the EBS unit in Addis, and she accepted to come over and train us formally on how to conduct event-based surveillance in the country.
Using the EBS as some of the documents we've used to adapt our work towards implementation of event-based surveillance in the country. We are now at a stage where we've developed the guidelines for Zambia, and Africa CDC has been very, very prominent in the offering technical support in the development of the same guide for Zambia.
During that workshop, we had what we call the event management system demonstrated to us, and we said, oh, on part of our EBS activities, I think we need that system. Then Africa CDC was happy to say, can we talk? Can we develop a concept? Can we see who is the player? Then we identified the players, okay? In the Ministry of Health, we had to have the Division of Health Information come in. We also had to have some programmers, that is HISP Uganda and HISP South Africa, they came over and they started developing the system for us.
The event management system was it's an initiative that we've embraced so well. With support from Africa CDC, we've now trained all the 116 districts in the country, and all the 116 districts now are able to use the EMS system for purposes of reporting the issues of generating reports, assessing risk, and also response. So all the documentation as it relates to management of events from signal detection to response is anchored on the system, and most of the districts are participating in the system.
Health security globally is not complete until every part of this world is safe from outbreaks and disease threats.
There is a framework which Africa CDC has, and they trained us on how to do a hotline EBS, facilitate EBS, facilitate best EBS, how to undertake call center, everything. And then we also had a chance to adopt the material we got from Africa CDC into Ugandan.
In the short period in which the EMS has been deployed in the country, we've seen quite a number of signals and events being posted on the system. COVID-19 has been one of the conditions that has been shared on the system. But other than COVID, we see that we are sharing a lot of information pertaining to vaccine-preventable diseases. In particular, it's the measles events. We've reported quite a number of chickenpox as well. Scabies have been picked up through the same system. But other than these skin conditions, we've seen it going beyond to report issues around bilharzia as some of the events that we are picking up.
The EMS in Uganda is still work in progress though, but we are so excited about what we have already achieved. The EMS has captured so many signals because at the level from community to the triage section where there's a lot of noise. We have levels in Uganda where we do the verification. For example, at national level, I will not go to a district, say Obonji or Kagadi, and I confirm an outbreak. No, there are structures already At the grassroots, there is what we call a district surveillance focal person. Even lower health sub-districts, there are several surveillance focal people. So as we receive it from the national level here, we'll triage it to them and they will confirm. We cannot say as Uganda that we are there yet. We still have some challenges, especially having the programming done to completion. Our event management system is still work in progress. We are still working on it together with our programmers from South Africa and Uganda, plus the local Ministry of Health Division of Health Information.
The implementation of EMS currently is anchored within the Ministry of Health, but our wish is that it needs to have an outlook of One Health surveillance, in the sense that the priority list of signals are not only related to human health, but cut across other sectors to do with animal health, environmental health, and the ecology. So we need partners on board to be part of the process. Other than that, you need huge investment in terms of the information, communication, and technology tools, in terms of computers, which needs to be deployed for our staff for use. The other aspect is obviously around interoperability of the systems, because the EMS system alone needs to communicate, for example, with epidemic intelligence from open sources. It needs to communicate with the Public Health Emergency Operations Center. So those are some of the challenges we have, but with the support from partners, we should be able to overcome those challenges and make the system even better within the country. Yeah.
Africa is willing, able, and ready to do its part. We are asking you, as our partners, to join us in implementing the new public health order so that we can be able to do things differently, to be able to achieve different and better results.